Hello, everyone. Welcome to the Daily Senior Safety Advice Podcast. This podcast is all about helping older adults and family caregivers stay safe, independent, and confident at home. I'm Esther Kane, a retired occupational therapist, certified aging in place specialist, and a dementia care specialist. If you'd like more helpful tips, then be sure to visit our website at seniorsafetyadvice.com. Today, we're going to talk about something that can feel scary, but is very important: how to recover after a fall. A few months ago, I was walking with a friend and I tripped over a sidewalk and fell right smack down. I will tell you that after that, not only was my knee sore, but I slowed down a little bit when taking the walks because I just was now scared of falling again. So that's what this podcast is about, addressing some of those issues. All right, so let's start with something that I've seen many times over the years. A fall can shake your confidence, as I said, sometimes even more than your body. You might feel sore. You certainly would probably feel embarrassed. And sometimes you might even feel afraid that it could happen again. And that fear can quietly change how you move, how you walk, and even how much you do each day. Now, here's something important to understand. Recovering after a fall is not just about healing your body. It's also about rebuilding your confidence. And both really matter. So let's walk through this together, step by step. Okay, first, let's talk about what to do right after a fall. If you've already fallen, or if this happens in the future, the first thing to do is to pause. Take a breath, stay still for a moment, and check your body. Ask yourself, do I feel pain anywhere? Did I hit my head? Can I move my arms and legs? If something feels wrong, especially your head, your hip, or your back, it's important to get help right away. That's why I think it's so important for everyone, no matter really what age, to always carry some type of an alert device. It could be an Invisaware product. It could be a smartwatch product. It could be a cell phone, as long as the cell phone doesn't go flying out of your hand while you're falling. Anything at all that you can use to call for help. Another thing I always tell people is that even if you feel okay, it's still a good idea to let your doctor know about the fall, because sometimes injuries don't show up right away. Now, let's talk about the next phase, the recovery phase. And this is where people often rush. Another thing I've noticed over the years is that many people try to bounce back too quickly. They think, oh no, I'm fine. I'll just get back to normal. But your body needs time. Even a small fall can affect your balance, your muscles, your confidence. So please give yourself permission to slow down. Start with a gentle movement. Short walks around the house, simple stretching, standing up and sitting down slowly and safely. These small movements help your body regain strength and coordination. And here's another thing that's very important. Avoid staying in bed or sitting all day. Too much rest can actually end up making you weaker. Okay, now here's something that you might find interesting. After a fall, many people start walking more carefully. I know I did after my fall, which sounds like a good thing, but sometimes they become too cautious. They shuffle, they take very small steps, they hold their breath, and this can actually increase the risk of another fall. So focus on walking with purpose. Stand tall, take steady steps, and use support if you need it. Just be aware of the environment that you're walking on. That might mean all of this might mean using a cane, a walker, or holding on to sturdy surface, or even using walking sticks. My sister recently fell on a hike, and her friends that she was walking with got her some walking sticks. So now she uses those every time she goes out on a walk. There is no shame in using support. In fact, it's one of the smartest things that you can do. Now, let's talk about your home environment, because this is often where falls happen. After a fall, it's a great time to look around your home with fresh eyes. Ask yourself, what might have caused this? Was it poor lighting? Was it a loose rug? Did you trip over something? Was it a slippery bathroom floor? And fixing even one of those small hazards can make a big difference. better lighting, non-slip mats, grab bars in the bathroom, clear walkways. If you have to step over things to continue walking, then that needs to be cleared away. These changes help protect you moving forward and help you stay independent longer in your home. Another thing I always share with my patients is that confidence comes from preparation. When your home feels safer, you naturally end up feeling more at ease. All right, now let's talk about something that doesn't really get discussed often enough. The emotional side of falling. After a fall, it's very common to feel anxious. It's very normal. You might think, what if it happens again? What if I can't get up next time? What if my injuries are much worse? These thoughts are normal, but they can also hold you back. So here's a gentle approach that you can try. Acknowledge the fear, but don't let it take over. In other words, start small. Walk a short distance. Practice getting up safely with support. Sit and stand with control. Each small success builds your confidence again, day after day. And over time, that fear begins to fade. Another thing that I've seen many times with my patients is that people who recover best are the ones who stay connected. They talk to family, they ask for help when needed, and they don't try to do everything alone. Believe me, that is not weakness. It's being smart, being very smart. If you're a caregiver listening to this, your role is also important here. Encourage, but don't rush. Support, but don't take over completely. Let your loved one rebuild their independence step by step. Now, before we wrap up, I want to share one more thought. Falling or a fall is not a failure. It's actually information. It's telling you that something needs attention. Maybe it's your strength. Maybe you need to build that up. Maybe it's your balance. Maybe you need to work on your core balance. Maybe it's the home environment. Maybe you need to have an assessment done to make sure that the home environment is as safe for you as possible. All of these are something you can learn from to continue making yourself as independent as possible for as long as possible. But a fall also gives us a chance to make things safer moving forward. And that actually can lead to greater confidence than before. So if you've experienced a fall, be patient with yourself. Take it one step at a time and know that recovery is not just possible. It's something that you can actively build. I want to thank you so much for being here with me today. If you'd like more tips and resources to help you or your loved ones stay safe at home, please visit seniorsafetyadvice.com. And if you're looking for professionals who specialize in aging in place, you can find help at aginginplacedirectory.com. If you found this particular podcast helpful, please consider subscribing to the podcast or the YouTube channel. And of course, share it with your loved ones who you think might find it useful. So until next time, this is Esther wishing you safety, confidence, and peace at home.